Our capillary punctures, adult patients, we're going to use the middle finger or the ring finger for puncture site. We're going to go at the side of the finger, and I will show you those next week. We try to stay away from the pinky and the thumb. Our hand veins are going to be on the dorsal side of the hand. Those are going to be our next choice after the AC. So if we can't find any of those 3 veins in the AC, we're going to go to the hand. Hand veins are a lot more fragile. They're going to roll a lot more. They're usually smaller, and they tend to be a lot more painful. So we do have quite a bit of nerves in our hands. The best way to draw out of a hand is using the butterfly needle. Again, I showed you guys that last week, but we'll do more with that next week when we're in class. Ankle and foot veins are always an option as well if we can't find anything, but those should be our last choice. Sometimes they're difficult to access. They're very easy to injure and very painful. Inspection and palpation when we're selecting our appropriate vein is very important. It's key. A suitable vein needs to be soft, flexible, and it needs to feel spongy or bouncy. Once we feel that vein, we want to trace its path. Again, not all veins are going to be straight. We want to palpate for its depth, its direction, and its dimension. And sometimes we might not be able to see or palpate the suitable vein. So what can we do to try and fix this? Think about that question and write down your answers. And then in the assignment that I'm going to be posting, you guys can answer that question. Locations that we need to stay away from for venipuncture would be above an IV site in an arm. Fluids can mix with the blood sample, and that could affect the results. So if we had to go in an arm with an IV, we would want to go below that IV site. An arm with the arteriovenous fistula shunt for hemodialysis or those dialysis patients, it can compromise the circulation in that arm and damage that shunt. So we want to stay away from that. The arm with the central venous access device, also we could damage that device. The AC on the same side of a mastectomy, as we talked about before, can cause swelling, injury, or even infection. So again, some of the veins are going to be easy to see, but just because we can see them does not mean that they're going to be suitable for venipuncture. So performing on these types of veins could possibly lead to vascular or even neurological damage, and we do not want to cause damage to our patient. Again, number one is patient safety. Blood supply can also be very poor in some of those veins, resulting in a poor collection and success rate. So we may end up having to poke our patient more than once. And again, our goal is to try to poke them the least amount of times as possible. Some examples of those veins that wouldn't be suitable would be sclerotic veins. Those are going to be very hard, inflexible, and narrow. And they're going to be very difficult to puncture and very painful if we are able to puncture. Tortuous veins, those are considered those varicose veins. So they're going to be twisted, they're going to be dilated, they're really going to lack that elasticity. They're not going to run straight. They could be easy to push the needle all the way through that vessel. Thrombotic veins, that's going to be a vein with a thrombus or a blood clot, and they can feel hard and inflexible as well. And those veins are going to be very tender to touch. So as we're palpating, the patient is probably going to feel some pain. Fragile veins are very common in older adults, in our newborns, our pediatric patients. Our fragile veins we're also going to see in those IV drug users. They're going to be very thin, weak, difficult to puncture. They're going to collapse easy, so they're not going to refill very quickly. And they're going to be, again, painful for the patient, and a lot of the times they're going to require multiple sticks. Our phlebotic veins, those are going to be tender and warm with a red area around them. They can also have clots and just, again, be difficult to puncture and very painful for the patient. Determining the patient's tolerance. Ask if they have ever had any problems before with venipuncture. So we want to look and listen to them. Do they seem anxious? What is their body language telling us? Does their voice have fear in it? We really need to pay attention to those types of things. Again, we don't want to make assumptions about a patient's veins regardless of their age. And again, just talk to those patients. If we see any of those or hear any of those things above, like the anxiousness, the body language, their voice, we need to really sit down and talk to them, kind of get their mind off the actual blood draw before we actually proceed. As phlebotomists, you may collect non-blood specimens. One of the common ones could be urine, so we could do routine urines, random urines, fasting urines, our clean catches, timed urines, our urine reagent test, which I will show you guys next week. It's possible that you could be collecting stool. So most common fecal occult blood test, which is going to identify if there's any blood in the stool. We may be collecting sputum. So don't confuse that with just plain spit. Sputum is going to be material that we cough up from our lungs. We're going to usually test the sputum in our respiratory patients. So like we talked about last week, if you're sick and you have that chest congestion and you're coughing up that gunk, that would be what would be considered the sputum that we would want to collect. And then sometimes semen as well. That is collected for fertility testing and checking that effectiveness of a vasectomy. So that is it for the patient preparation. Please listen to this, look at the slides. If you have any questions, write them down. In the agenda, you're going to see where I want you to email me. If you have any questions, I'm hoping that everybody can at least find 1 to 2 questions to ask. There was a question that I had asked in one of these slides as well. That's where you will answer that, is in that email. Next week, we will be looking at the veins, those different veins in our arms. I'll show you some of the reagent testings and those types of things as well. So I hope this came through okay with you guys. Again, don't forget to respond to my email. You guys are also, will be taking the test from last week. So reminder for that, make sure all your tabs are closed. Don't use books, notes, those types of things. Be honest when you're taking that test. And I will see you guys next Wednesday. And don't forget to email me if you have any questions.